Remember last Easter? The lowered volume on sound systems, significantly decreased gatherings, or the words isolation and quarantine becoming commonplace in our vocabularies? It felt new, a seeming comma in an age-old tradition. Well, that comma stays a bit longer because we are still taking actions to end COVID-19. Nevertheless, the true meaning behind Easter Monday remains. A time for penance, family and reflection on Christ's death and resurrection. Welcome to another Easter Monday with Jamaica Magazine. I'm Adrian Atkinson. Let's delve into the details right now.
The numbers keep climbing, and yet some of you are still complaining about curfew times. Is that being selfish, or are you being smart? You continue to blame the government, stating they are not doing enough. But the big question is, are you doing your part to help decrease the spread? The unfortunate reality is that far too many people refuse to take the coronavirus pandemic seriously until they or someone they love gets infected. Now, this is what we do not want, and I don't believe I can stress this enough. Wear your mask, sanitize. Of course, we love to hug and socialize, but just ease off some of that right now, not just for your safety, but also for others. It look hard for your relatives to be home doing all they need to in order not to catch the virus, and you out on the road being reckless and carrying it right home to them. Each one of us needs to help during this fight against COVID-19 as we work to make Jamaica the place of choice to live, work, raise families, and do business in a healthy environment.
Today's conversation is riddled with COVID-19 topics like control and prevention measures, the coronavirus and its impact, who is taking what vaccine and why. Lots of discussion with a ton load of questions. Well, as a source for news you can use, we're providing answers. And whatever you don't get here, check out our website and social media platforms.
The AstraZeneca vaccine at this time is being offered to pregnant and lactating women in the healthcare sector. So if you're a healthcare provider, then that's the recommendation. But we need to explain that just a bit. So in clinical trials, pregnant women as well as children are not usually looked at all. It is until vaccines and other medications have passed through the phases and is now in the general population where thousands of persons get the medication that we then turn our attention to looking at trials in children and pregnant women. So we don't have a lot of data, but what we do know is the characteristics of this vaccine that we're talking about. It's non-replicating, which means that this vaccine will not cross over into the placenta, and therefore the fetus is protected. This vaccine will also not get into breast milk, and therefore the baby is protected from getting any ill effect of the vaccine. So we have the science of the vaccine that it is safe. And we also now know that healthcare workers in the reproductive age range, if they get the disease, they do so much worse. Not only do they themselves do badly, but they tend to have premature babies. So when you look at that risk benefit, then the risk of getting the vaccine, because it is safe, we know it's not getting into the placenta, not going into breast milk, and we look at the impact of the disease on these very exposed persons, then we adhere to the recommendation of the Strategic Advisory Group that healthcare workers should be offered. But as we get more information, then the vaccine may be offered to the entire population, the entire pregnant and lactating population, but not at this step.
The issue of mentally ill persons has been very high on our agenda, as not just mentally ill, but also the homeless. So we have been making contact with the agencies who know where these people are and who they trust, because there's a trust issue here. So there are some agencies, Salvation Army, that feed them. There's National Council for Drug Abuse that has surveys. So they are, whereas we cannot say exactly how they are going to be done, they have certainly factored into the conversation. And the issue of seniors who are unable for various reasons, and there's two groups. There's those that are physically impaired, and there are also those that are mentally impaired that would be very disruptive staying within a center. And we have given consideration, so persons will stay in a car and somebody will go out to them. But you see, we have to do the observation, we have to do all of the other things that everybody has spoken to. But yes, so these things are being taken into consideration as we seek to vaccinate. You will take the vaccine when you get your appointment, and you will take your medications at the time that you normally do. Most people take it in the morning, certainly after breakfast or something, but you do have people that take it in the evening. So stick to your regular regime for your medications and keep your appointment for your vaccine. You can take it at any time, but there's another concern with older population. A lot of the medications, especially the hypertensive medications, send you to the bathroom. And a lot of older people do not take their medication when they're going out, whether it's to the health center and to get a vaccine. It will be okay if you don't take your medication because that's your normal practice, because you don't want to get caught on the bus or something. But take it as you would when you come home.
I doubt it very much. I don't think that has been tested. Thousands of women have already got the vaccine, and we're seeing no ill effect at all. And we are confident that over time, as we get more experience, because some women who have got the vaccine are now pregnant and they're being followed, we are confident that the vaccine will probably be safe, even among pregnant women as well.
The vaccine will protect you from severe illness, possible hospitalization, and even death. And that is why we go right back to our IPC measures, because your family need to also remain in their bubble that is safe, and you will need to continue wearing your mask. So will everybody in the family do the hand wash thing, sanitize, and physical distance as appropriate. We're not vaccinating children. No, we're not, because they weren't a part of the clinical trials. So as we vaccinate older persons with comorbid conditions, we have to continue to preach the message to our children, to our younger persons. We've got to wear our masks, we've got to do the hand wash, and we've got to physically distance until we have vaccinated enough persons in the population so that we have attained herd immunity.
To properly carry out a hand rub, apply a palmful of the product in your cupped hand, covering all surfaces. Rub your hands palm to palm. Rub your right palm over the back of your left hand with interlaced fingers and vice versa. Rub your hands palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked. Rotationally rub backwards and forwards the clasped fingers of your right hand in your left palm and vice versa. Once your hands are dry, they are now safe.
If you need any more of your COVID-19 questions answered, drop a note on any of our social media pages. Chances are we have already done, and if needed, we'll do the research. Besides, we've compiled some more useful information on how this virus works. If you already know, then that's good. But repetition, they say, is the mother of learning. Watch this.
Coronaviruses are a large family of viruses found in both animals and humans. Some infect people and are known to cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. Research reveals that SARS-CoV was transmitted from civet cats to humans in China in 2002 and MERS-CoV from dromedary camels to humans in Saudi Arabia in 2012. A novel coronavirus, novel meaning new strain of the coronavirus not previously identified in humans, was identified after an outbreak was reported in Wuhan, China in December 2019. It has subsequently spread to a number of other countries through human-to-human contact, and the World Health Organization has since officially named it COVID-19. The incubation period for viruses is the time between infection and the start of clinical symptoms of the disease. Based on information from other coronavirus diseases, such as MERS and SARS, the incubation period of the 2019 novel coronavirus, or COVID-19, is determined to be up to 14 days. As with other respiratory illnesses, this disease can cause mild symptoms, including a runny nose, sore throat, cough, and fever. For coronavirus generally, the person is most infectious when displaying symptoms. It is difficult to identify COVID-19 based on symptoms alone, as they are typically the same as infections of the flu or cold. A laboratory test is therefore needed to confirm if someone has the coronavirus. The infection can be more severe for some persons and can lead to pneumonia or breathing difficulties. More rarely, the disease can be fatal. Older persons and people with pre-existing medical conditions such as asthma, diabetes, and heart disease are deemed more vulnerable to becoming severely ill with the virus. The new coronavirus spreads primarily through contact with an infected person. It spread through respiratory droplets generated when a person coughs or sneezes, or through droplets of saliva or discharge from the nose. To prevent spread, it's important that everyone practice good respiratory hygiene.
It's a similar respiratory precaution as we would take for influenza.
For example, sneeze or cough into a flexed elbow, or use a tissue and discard it immediately into a closed bin. Washing your hands frequently with soap and water or using an alcohol-based hand sanitizer eliminates the virus if it is on your hands.
Washing of hands is very, very important because any kind of droplets that get on your hand, you can transfer to your face, and you can therefore get it into your ear passages or into the eyes and cause an infection.
When someone who is infected with a respiratory disease like COVID-19 coughs or sneezes, that person projects small droplets containing the virus. If you are too close, you can breathe in the virus.
The general precautions in terms of making sure that you keep your distance.
Keeping this distance between yourself and other people, particularly those who are coughing, sneezing, and have a fever, helps to prevent those persons who don't have the virus from getting it.
If you are sick, to stay away from other persons, that means not going to work or school.
Someone who is coughing and sneezing should wear an approved mask where necessary. Data collected by the WHO so far suggests that the coronavirus may survive a few hours on surfaces, and applying disinfectants to surfaces can kill the virus, making it no longer possible to infect people in this way. To avoid getting infected, do not touch your eyes, nose, or mouth after touching any surface. Inform healthcare providers of any overseas travel in the 14 days before your symptoms developed, or if you've been in close contact with someone who has been sick with respiratory symptoms. To date, there's no specific medicine recommended to prevent or treat the new coronavirus or COVID-19. But persons infected with the virus should receive appropriate care to relieve and treat symptoms, and those with severe illness should receive optimized supportive care. Remember, practice good respiratory and hand hygiene.
It's absolutely critical that we receive the vaccines. You will see hospitalizations and indeed deaths likely come down. And so there is a lot of value to be gained by getting as many vulnerables on board as possible. So tell your mothers, tell your aunts, listen out for yourselves if you're over 60, and take the vax, because the vax is what will help you to guard against the COVID virus and indeed help your relatives, your friends, those who you come in contact with for the same benefit.
More COVID-19 information comes up next, but this time it's in relation to one of your closest devices, your phone.
Android, iOS, non-internet based. It doesn't matter the brand, type, model, or cost. Phones need to be periodically cleaned. There are no apps, not yet, that will de-germ the outer surface of these mobile gadgets. And unless you have an ultraviolet UV sanitizer toolkit, you'll have to manually decontaminate the device. Germs are everywhere, and so too are our phones, inside a bag or pocket, on a table or counter, the car, bed, even in our hands. Placing our phones on these surfaces puts them in constant contact with germs, even the novel coronavirus. And according to the World Health Organization, the virus has a lifespan of up to 96 hours on surfaces. That's 4 full days on plastic or metals, the type of exterior shell of many phones. Constant touching of the phone with naked fingers that we then use to touch our faces, or directly placing the phone to our faces, is a recipe for transmitting germs, bacteria, or viruses to the body.
First thing I do when I get home is I clean my phone. Because you're touching your phone and you're touching this surface that somebody else just touched, and then you put the phone to your mouth and you ha. And all of these particles that have ended up on the phone, they end up in you.
Apart from just not using a phone, our only defense is to clean them regularly. Soap and water would be best, but no, you should not submerge your phone in liquid. Instead, first wash your hands with soap and water, then dry them. Ensure that your phone is unplugged to prevent a possible electrical shock. Then, dab a clean cloth, preferably a microfiber or lens cloth, with a 70% isopropyl alcohol solution, and wipe the entire surface of your phone. Do not drench the cloth with too much solution, just sufficient to clean the device. In addition, be careful to avoid getting moisture into any openings. If you don't have an alcohol-based cleaning solution at hand, you can also use alcohol wipes. You should ensure the wipes have a relatively high concentration of alcohol. The best is 70% and above. This ensures that any viruses that are on your phone can be effectively killed. While you sanitize your phone, avoid using aerosol sprays, abrasives, and cleaners. And do not spray directly onto the phone screen or back. Bleach should also not be used to clean the phone, as it may damage the surface. It is also best to wipe any relevant accessories used with your phone. Chargers, headsets, and phone cases should be sanitized at the same time you clean your device. They should also be removed from the device when cleaning. Now your phone and its friends are clean. To prevent putting your phone against your face or the likelihood of transferring germs or viruses, use Bluetooth, a virtual assistant, or hands-free speaker system if you can.
It's a new beginning. New day is dawning. It's time to arise. We are the gene of achievement and pride.
Bold new beginning, time for action. We have the spirit to fight on.
This is Jamaica, this is our land. We have our future with God in our plan. We'll play our part building this great nation. This is Jamaica, this is our land.
Let us make every effort to forge unity. I resolve to work hard for our prosperity.
Leaving our children a legacy of hope, breaking the shackles and smashing the yoke. This is Jamaica. This is Jamaica. This is our land. This is our We have our future with God in our plan. We'll play our part building this great nation. This is Jamaica. This
Let me hear the children say.
This is Jamaica. This is our land. We have our future with God in our plan. We'll play our part building this great nation. This is Jamaica. Come on, everybody, let's sing. This is Jamaica. This is our land. We have our future with God in our plan. We'll play our part building this great nation. This is Jamaica. This is our land. Jamaica, together we can.
April is Autism Awareness Month, and so we thought it fitting to share with you the story of Adriana Francis and her fight with this developmental disorder. As you practice all that goes with a day like today, Easter Monday, think of ways to extend that compassion and patience to those in a battle with autism.
Slide. 1, 2, 3, go! Woo! Good job. Let's go into the play out. All right.
When she was about 6 months, I realized that she wasn't sitting up. She wasn't creeping. She wasn't making any attempts like that. As a newborn baby coming up, she didn't cry. She hardly cried and she didn't interact with me, really. She would make eye contact now and then. One of the signs of autism is that the children do not make eye contact. They tend to have sensitivity of their hand middles, their foot bottoms, and their mouths, oral sensitivity. Some of them take a long time to get used to changes, to different situations, to different persons.
Adriana would be on the moderate to severe level of the spectrum, and she also has something called global developmental delays, meaning several areas of her development are affected.
I listen to the radio. Very good. Good job. We're going to go to your favorite place ever, to the playfield. Time to pack up, Adriana. Time to pack up.
For the child with autism, it's very difficult to move from one activity to another. Adriana has problems with those.
Well, I have to find ways to distract her, like I'll sing with her. I'll say a favorite poem or something that will distract her. I give her a toy that will distract her from what she's doing and get her interested in something else. Come, wait for your shoes. We have to put on your shoes to go to the playfield. Come here. Come this way. Come, we're going to the swing. Going to the swing.
She likes to be actually free in her environment, and so any opportunity given, she'll be running away. And as such, the shadow is very, very important in her life in order to help her to know danger and to keep her on focus.
I've been a shadow for Adriana since September 2013. I help her with her academics, self-help skills, social skills. For instance, carrying her to the playground. In all areas, I watch her for the whole day that she's at school.
She won 2 of her events in sports that just gone, and she got 2 gold medals for that. She did a flat race, 25 meter. She won that race, and we had obstacle race. and she won that race also.
Sometimes it's a happy journey, sometimes it feels easy, sometimes it feels overwhelming, like you just can't go another day, you know, but at the end of the day, as long as there's love for her, then you can find a strength. Adriana has a little sister who is like her big little sister. When Adriana should have been the one maybe helping to put baby to sleep, baby is the one helping to put Adriana to sleep. She will follow whatever Elisa does, she will listen. Her big brother, DeMarco, he's 14, going 15, and he has been, from Adriana was a baby, he wanted to change diapers. He wanted to take care of his sister, and he still does. Her daddy he's a good support too. Her dad picks her up every morning, takes her home every evening.
I wouldn't miss it for the world. I would do it every day, every day. If that child is a part of you, whichever way life turns, whichever way things turn, be there for your child. Were it not for you, that child wouldn't be here. And if every father would do the same, just be there for your child. That's the basic law of humanity. Be there for your child.
Now a quick word from our expert epidemiologist, Professor Figueroa, on the AstraZeneca vaccine.
Now, I know there is a concern among many persons, how did they make the vaccine so quickly? But what many people do not realize is that they were trying to produce a vaccine against the coronavirus from after the 2003 SARS epidemic in China. So from that time, they've been working, how do we get a vaccine against the spike protein of this coronavirus? So when we had the COVID outbreak and the Chinese managed to sequence the genetic code of the coronavirus, which causes COVID, this virus is a cousin of the SARS coronavirus. So what they were able to do is the vaccine that they were trying to prepare against SARS, they simply adjusted it to address the difference in the genetic code, so that when you get an injection in your arm, it goes into the muscle, and the vaccine just enables you to produce a protein which mimics the protein of the spike protein of the coronavirus.
Our 30 minutes ends here. Well, we have just a few more seconds to go. Thanks so much for inviting us into your homes this Easter Monday. A bulk of information was shared today, and here's the good news. It can all be accessed again whenever you're ready. Visit the JIS YouTube channel for this and other shows, and check out our website and Facebook, Instagram and Twitter pages. From all of us here at the JIS, wash your hands, sanitize, and wear your mask. I'm Adrian Atkinson. Happy Easter Monday, and see you soon.
This has been a production of the Jamaica Information Service, the voice of Jamaica.